Dr. Rafeyan, with, we collaborate on a couple of research projects with your group at Northwestern. So I have a little bit of a insider knowledge as to how you guys and how your group educates clinicians and researchers on the use of different clinical instruments, different research instruments. But I want to hear a little bit from the other side of the fence, from your clinical practice. What are some elements of measuring and sharing the measurement with patients that you find that really motivates treatment and really enhances treatment?
Great question. I have to go back and look, as Dr. Trivedi was presenting, I was thinking, when did I start implementing measurement?
Right.
And actually, quite a few years ago, because my experience was sometimes I will see a patient, and I usually have medical students and residents with me. And in my opinion, I thought the patient was doing well. Then just in order to make him familiar with the HAM-D, I would pull out the HAM-D and show him how to score one. To my surprise, they will still score a 12, 13, and when I thought they were doing fine.
Yes.
So years ago, I started implementing, and it was an eye-opener for me that even the patients that I thought were doing fabulous, and in my opinion, they were in remission, they still were symptomatic. So I have started implementing it on a routine basis in my clinical practice. Going back to what has been discussed, it is very helpful in two ways. One is, as a clinician, it gives us a standard and number. Going to use your analogy, similar to following white blood cell counts. So I know it's going up, down, or staying the same. Two, for the patients. Sometimes patients come back and they may not have that much insight into their symptoms.
Correct.
And they say, well, I still feel the same. So I can show them what was their score 3 weeks ago and what is their score now with the intervention that's been taken. So it becomes a very subjective, objective way of measuring improvement or lack of improvement in many of the patients.